Hello, magandang hapon po. I'm Dr. Ana York Bondoc and thank you for joining us po sa ating pong YouTube and Facebook live stream. Our program is called Libreng Consulta and we are happy to answer any questions that you may have today. Our topic, and I'm sure marami rin pong gustong malaman po ito, is mga side effects ng bakuna. So we will go, siguro ang ano natin po is true or false. Pag-usapan po natin yung bawat choices as we discuss po yung mga side effects. Ba't ko po pinili yung side effects? Well, studies have shown that the number one reason for vaccine hesitancy in the Philippines is natatakot po sa mga side effects. So wag po kayong matakot and pag-usapan po natin yung mga posibleng side effects at ano po ang ating dapat paghandaan and paano po natin pwedeng maintindihan at wag magulat at wag matakot sa mga side effects po ng mga bakuna. So please join us, like and subscribe our YouTube channel. We are trying to reach po 1,000 subscribers. And please also watch, nandun po yung mga dati po nating pinag-usapan. For those joining us today, you may put your questions below. Marami na rin pong nagpadala from YouTube and we are happy to discuss the number one reason for vaccine hesitancy o bakit natatakot ang mga tao. Ito po ay dahil sa side effects. So wag kayong matakot, listen to us. Okay? So let's start with true or false. Ano nga ba ang side effects? O no, what are the side effects of bakunas? Yung side effects po or adverse effects po, yun ang mga secondary and unwanted effects due to drug treatment or vaccine treatment. Meron din pong mga adverse effects, yun po ang unintended pharmacologic events that occur when the medications are administered correctly. So meron pong adverse effects, meron din pong side effects or adverse events. So pag-usapan po natin, let's go. Letter A, Miss Reina. What's letter A? True or false?
True or false? Lahat ng nababakunahan ay magkakaroon ng side effects.
Okay, Miss Kat. Yes, true or false? Kayo, Miss Reina, true or false?
Doc, depende po sa sa tao po talaga to eh. Yung side effects, depende po siya sa tao.
So the answer is false, no? Hindi po lahat ng nabakunahan ay magkakaroon ng side effects. So not everybody. Marami pong nababakunahan na walang nararamdaman, marami rin pong nababakunahan na may nararamdaman. So hindi po natin alam, do we know kung sino po ang mahuhulog sa walang nararamdaman or may nararamdaman? Hindi po natin alam yun eh. It really depends sa tao. Tama si Miss Reina, it depends kung ano yung bakuna, it depends kung sino po yung nabakunahan. What I can tell about side effects po, most of the people who suffer side effects, anecdotally po, no, they are younger. Mostly po, as people get older, they don't have side effects. Bakit po yun, ano? Some people do mention, I have researched this, I have heard a lot of doctors say that you do have side effects because it is your immune system reacting to the antigen, whether it is an inactivated vaccine, yung patay na po na sa COVID na i-injectionan sa inyo, or whether your body is forming the spike protein from na pinasok po sa katawan from ito po ang AstraZeneca or messenger RNA, ito po ang Pfizer and Moderna. Sinasabi po ng maraming eksperto in the field that side effects are from your body reacting to the vaccine. Okay, next. Letter B, number 2.
Letter B, ang pagkakataon ng side effects ng bakuna ay senyales ng magandang immune response sa bakuna.
Well, I would say this is true. I have listened and researched a lot about this. And they do say na, in fact, sometimes yung nangyayari po sa atin when we get, it's similar to like having a slight fever, a flu, bumibigat po yung kamay, yun po yung tinatawag pong local side effects, yung arm effects, which is kung minsan umiinit, bumibigat Yun po yung local side effects. Meron pong systemic side effects. The meaning of systemic is throughout the entire body. And some of these could be tiredness, headache, muscle fatigue, chills, fever, and even nausea. So, yung side effects po, they can be local in your arm or throughout the entire body. Ano? And most doctors do say, and I've researched this a lot, is that it's from the immune system reacting. So yes, it could be true na when you have side effects, it could be due to your immune system. Okay?
Letter C, kapag walang nararamdaman na side effects, likely wala ka ring nakuhang proteksyon sa
Ay, napuputol po. Ako po ba ang mahina ang signal o kayo po?
Si ate po yung naputol. Ulitin ko na
Okay.
lang po.
Yes.
So, letter C, kapag walang nararamdaman na side effects, likely wala ka ring nakuhang proteksyon sa bakuna. Maaaring tubig lang ang nasa injection mo.
Ang daming nagtanong sa akin nito, no? People ask me this eh. My own pamangkin sent me an FB Messenger. Tita, I'm so scared. Baka walang laman yung bakunang nabigay sa akin. Okay, eto lang. Though I told you that I researched that B usually is correct na um, experts do say that it's your body reacting to the vaccine. Yung pagkakabaliktad naman nun, people are worried na if you don't have any side effects, then your body didn't get anything or your body's not reacting or wala ka ng antibodies na ma-form. I'd like to reassure everyone that that is not true. People with side effects and without side effects, they have had their antibodies measured and they do have antibodies. So it does not correspond po kung maraming side effects, maraming antibodies. Hindi po, no? So both walang side effect and merong side effect do have antibodies. It is not measurable na kung marami, ganun. Hindi po ganun, ano? And I'd like to also reassure persons na aside from measuring antibodies, actually, meron pong substances po sa ating dugo. These are called our memory cells. The B cells and the T cells, we cannot measure those po. But they also become activated once we are vaccinated. At yun din po can help us fight the COVID pag tayo po ay na-expose. So, no, it's not true na kung wala kang naramdaman, hindi gumana yung katawan mo. Hindi po totoo yun. Okay? Reassured na hindi po tubig yon. But ang dami pong nagtanong sa akin yan. Okay? Next po.
letter D, mas grabe ang side effects ng second dose ng bakuna.
Well, I have actually researched this. And for the messenger RNA vaccines, that is the Pfizer and Moderna, studies have shown that, yes, the side effects of the second dose might actually be more, slightly more pronounced. Totoo ho yan. Okay? However, I did ask this question to my classmate, si Dr. Carmen Batacan Rivera, who's worked, is a vaccinologist, worked all over na po, including for Sanofi and Johnson and Johnson. She's now with Johnson and Johnson. Ang sabi po niya talaga sa akin is the data has shown that the AstraZeneca second dose is actually, the side effects are milder than the first dose. So she messaged me that the messenger RNA vaccines, the second dose is worse. For Astra daw, the second dose is not as serious side effects. So that is very good kasi sa Pilipinas po, a lot of us have taken Astra. I am trying po to search for the article on this, but what I found po, kasi most of the Astra has been given in the United Kingdom. And actually, magugulat po kayo, but most of the United Kingdom, Reyna, first dose pa lang. So, wala pa po tayong total second dose data on Astra. So, I'm still searching for that. But anecdotally, from an expert, sinabi po sa akin that the Astra vaccines, the second dose is milder. Okay, next.
Next is, baka ma-ospital ka or mamatay sa side effects ng mga bakuna.
Well, it is, I would not tell you na hindi possible yon, ano? Let's tackle muna ma-ospital. Yes, it's possible ho. If you got like very high fever or talagang nanghina po kayo, posible po talagang ma-ospital and it has happened. But again, it is rare. Kasi po, in the UK, almost more than 25 million na po ang nabakunahan. Konting-konti pa lang talaga po ang na-ospital. With regards to dying, as of now, the only dying na talagang inimbestiga po and proven is from the blood clots. And out of more than, again, millions and millions na binigay, 18 persons have passed away. Those were 18. So, ang ano po talaga is the risks, the benefits, kung anong maganda po, no, that we can get from the bakuna, mas maliit po siya talaga sa risks. So, it was initially po the first 18 ang nag-pass away in the UK, but inimbestiga po ito ng European, they was investigated by the European Regulatory Agency, at ito pong nangyaring ito is very rare. Again, meron naman pong lunas. So, I would say, and the experts have said, na yung benefits po talaga ng pagbabakuna, it's much better po than the risks. And yes, I will not tell you po na walang na-ospital, kasi mali yun. Merong na-ospital, pero hindi naman po sila naging seryoso. And the issue of blood clots po sa AstraZeneca, pinag-aaralan din po. And of these 18, parang alam na rin po nila how to handle this. These were the first 18. Again, sa Pilipinas, wala pa pong nangyaring ganito. Okay?
Okay, next po. Question na tayo yata, Tora.
Opo.
Okay,
Hanggang letter
so
E
yun
lang
po
po.
yung mga those are some of the questions that people have asked me regarding vaccines. I hope I answered them honestly and completely, kasi there will be people who will tell you po na walang side effects or walang namatay o walang hospital, but I guess it's better to be honest. So, last words on the side effects, magkakaroon ho talaga ng side effects ang bakuna. And this has been good. This is not only for the COVID vaccine. This has been going on for MMR, polio, lahat, chickenpox, lahat po yan may side effects. But what we should think about is, ano po yung benefit at ano po yung risk. So yung benefit po, hindi po tayo mamamatay sa COVID. The risks, they are minimal. I cannot tell you they are zero. Walang zero eh. Wala po talagang zero. Just crossing the street, pwede po tayo masagasaan. But what we have to think about po is, ano po yung benepisyo na makukuha natin from the bakuna versus the side effects. So I'd like to reassure you, everyone, the side effects are rare. The serious side effects are rare. Yung mga bumibigat ang kamay, napapagod, yes, they can happen. But number 3, mas maganda pa rin hong mabakunahan. And number 4, I'd like to mention this, which I did not mention. Baka hindi nyo po alam, and I think very few people have discussed this. Meron po tayong sistema, the World Health Organization and the various countries, meron po tayong adverse event reporting system. Ano po yung meaning nun? Pag meron pong naging serious side effects ang isang bakuna, in the US, they have meron po silang tinatawag pong Vaccine Adverse Event Reporting System. Pag meron nung nangyari sa inyo, I'd like to tell you this, pag meron nangyari po sa US na hindi po maganda regarding the vaccine, they actually report it. May sistema po sila of reporting. In the UK, this is also called the yellow card system. Actually, kahit wala kang nararamdaman, dapat i-report nyo rin po yun eh. In the Philippines, we have what we call, together with the FDA, the National Adverse Events Following Immunization Committee. And this committee is headed by a professor from the University of the Philippines and one of the most esteemed vaccinologists po sa Pilipinas, and she's actually a friend of mine. Her name is Dr. Lulu Bravo. So anything na talaga pong side effect na grabe, you should be reporting this po to the National Adverse Events Following Immunization Committee. Kung hindi nyo po alam, just message po the FDA and may sasagot po sa kanila. Okay? So yun po yan. I'd like to reassure everyone that the Philippines is also monitoring po all side effects.
Okay, next po, Miss Kat. Miss Kat? From Miss Pasha Jose, from Mr. Pasha Jose Arnel. Good afternoon, Congresswoman Dr. Ana York Bondoc. Salamat po sa pagbibigay ng update and info sa mga tao.
Thank you also. Talagang kailangan po nating malaman to because 39% pala were worried about side effects. So pag-usapan po natin yung side effects. What is it about side effects po na talagang naninervyos kayo?
Next po, Miss Kat. From Miss Kathy Rodriguez. Hi, Doc. At last, present sa live now.
Hi, Miss Kathy. Ay, pala, if anyone has suffered any side effects sa bakuna, you can share them also. Let's talk about it po. I would like to say, no, how about this question? How long will a side effect last? Yan ang tinanong po sa akin ni Miss Reina nung isang araw. It can be, most of the people po, 24 hours. Some people po, up to 48 hours. And it can be actually rather prolonged. So, what to do after kayo po ay nabakunahan? Ako po, nung nabakunahan po yung mga empleyado ko, and myself and my husband, parang naghanda po ako that the night after and the day after po, at yung gabi, tsaka the next day, parang nag-relax lang po ako. Hindi ko po pinilit na marami po akong gagawin. You just have to really prepare and take time out na baka ho kayo magkaroon ng side effects, baka naman hindi. So, it's okay po, like, wag ho kayong mag-schedule ng pinakagrabe hong ang gagawin the day after. Basically, take it easy and step by step po, tingnan niyo po yung inyong nararamdaman.
Okay. From one of our viewers, I'm scared of side effects. Help, Doktora.
Ay, wag po kayong matakot kasi as I explained to you, number one, side effects are rare. What's the meaning of rare? Hindi po pangkaraniwan. And if ever magkakaroon po kayo ng side effect, most likely it's gonna be mild. Kung sakali naman po, I'd like to also let you know na 15 minutes after the bakuna, imo-monitor ho talaga kayong mabuti ng DOH. You will have your blood pressure, titingnan po yung pulse, yung paghinga nyo. Hindi talaga kayo pwedeng umalis po doon na hindi po kayo okay. And once you go home, again, i-advise din po kayo what to expect. And really, don't worry. Nakaka-nervous po talaga. Kaya lang marami naman ho tayo magkasama. So I think that's more than okay.
Okay. From Miss Kathy Rodriguez, Doc Anna, how true is Astra and Pfizer has the same efficacy, 85 to 90%, or it is based on data provided by manufacturer to be 63% effective?
Ma'am, let's not, it's how we look at the vaccine. First of all, hindi po ito contest. Okay, this is not a contest between vaccines. This is a contest po of us versus COVID. Yun. Kasi parang nagiging, inaano-ano natin yung mga vaccines, one versus the other. So I'd like to let everyone know this is not a contest between Pfizer and Moderna, Pfizer versus Sinovac, Inchik versus Russians. Ano ko this is a fight between the persons versus, and this is not also a fight between Duterte and yung Dilawan, ha. This is a fight between us as a nation and persons, the world versus the COVID. So, how can we, which is the better vaccine? Hindi po talaga, yung sabihin na mas efficacious ito, mas efficacious, hindi po natin malalaman po yan. Bakit? Kasi po, para po makumpara natin ang isang bagay or isang bakuna, dapat po, tapatan po silang makumpara. What does that mean? It means po that when we do the trials, it should be kalahati ng tao bibigyan ng Pfizer, kalahati ng tao bibigyan ng Astra. Lumabas kayo, titingnan po natin kung sino dyan ang magkaka-COVID. But unfortunately, hindi po ganun ginawa po yung ating pong mga clinical trials. Ang nangyari po, yung grupo ng Astra, binakunahan yung Astra at walang Astra. So, Astra versus placebo. And then, lumabas po sila and tiningnan po who got COVID. And then, that happened po in Brazil, UK, and US for Astra. For, sabihin na po natin Pfizer, it happened po in the US. So people were vaccinated with Pfizer and people were not vaccinated. And then lumabas po sila, tinignan ko sino nagko-COVID. So because they were done on different people in different places at different times po. Kasi yung iba may surge, yung iba walang surge. Ganun po, no? So, because of that, parang apples ito at oranges ito. We cannot, hindi po natin pwedeng ipagtapat at sabihin po natin na mas maganda po yung efficacy ni Pfizer, mas maganda po yung efficacy ni Astra. Hindi po, we will never know that eh. Opo, ang kailangan lang po nating malaman is that the vaccines, all of them, ginawa po ng magandang trial. Number 2, well-supervised po talaga. Number 3, all of them were found to have very good efficacy po for serious hospitalization, to avoid COVID deaths, and to avoid po ICU. So yun po, malaking bagay na po. Now, whether we cannot compare the efficacy po. What I could tell you po is, the more people get vaccinated with different vaccines, ano po, mas safe po tayong lahat kasi lahat po tayo protektado. Ngayon, the virus works by jumping from person to person. Kung wala pong ma-jumpan si virus, mamamatay po siya. And mawala na po si COVID. And so that's why we can't answer po the question. Mahirap po talagang it's hard concept to understand. Kasi of course people want the best. Ako rin I want the best Kaya lang we don't really know what's the best eh. Kasi po hindi naman po natin kinompare sila. Ang ginawa po natin, they were tested at different times, tested to be safe, tested na yung nabakunahan, mas mababa po yung rate ng COVID kaysa sa hindi po nabakunahan. Rains, na-gets mo ba yun?
Yes po, Doktora. Maliwanag
Oo, kasi
siya.
that's really the most common, Ma'am Cathy, that is the most common question that people ask me. And of course, I cannot blame everybody. Sino ba naman ang may ayaw na best? 'Di ba? Kaya lang, paano natin malalaman kung ano yung best? Hindi naman natin sila kino-compare. Or hindi sila, parang Reyna, I mean, like, how can I explain this? Hindi sila ginanon eh. Hindi sila pinagtapat. Malinaw ba yun? I don't know, but I'm hoping.
Parang ganito lang yan. This is my analogy for that, Doktora. Sana makatulong.
Sige.
Parang sa paracetamol, anong bibigay mong paracetamol? Biogesic ba? Tempra ba? Or yung ano lang, yung generic lang? So, parang ganun siya. Pero all of them have the same
Na-test
purpose.
naman sila, promise.
Yes, have the same purpose na para to bring down your fever. So, I think ganun lang din naman po. Tama po of saying na if practicality comes to show, kung ano yung available, sige na po, kuhanin nyo na po. Yun lamang po.
Oo, kasi while we're waiting, and this is not for Ma'am Cathy, this is for everyone, I published this also. Habang hinihintay po natin yung perfect vaccine, baka huma-COVID tayo eh. Yung risk po talaga nandun eh. Mabuti ho, bumaba na yung risk sa Pilipinas, but it still exists. So thanks Ma'am Cathy for this question. And I'm sorry po talaga na hindi ko po siya talaga masagot kasi hindi siya talaga dapat kinukumpara. Iyon.
Okay. From Miss Cathy Rodriguez, Dr. Ana, done with my first dose AstraZeneca. Side effects for me is fatigue, a fever, body aches, nausea, and pains at the site of injection. I guess everyone reacts to vaccines differently, while others may experience multiple side effects.
Totoo yan, ma'am. Eto nga pong, that is true. It really depends on the individual person po. And we cannot, as of this time, we cannot say who's gonna get side effects or not. But what we know is that people who are younger tend to have more side effects than people who are older. If you want a story about young and old, ito yung malungkot. Ayun ho, ako nabakunahan ng Sinovac. Wala po akong naramdaman for dose 1 and dose 2. Si husband naman po, after Astra, called me, very worried. Inalagdat daw siya, he's feeling chills. And he took daw a paracetamol and then he stayed in his bed the whole night. Kasi nasa Manila po kami noon. So, paano daw ba yon, mommy? Sabi niya. Sabi ko, daddy, huwag ka mag-alala. Yung mga, studies have shown that people who are young get more side effects than people who are old. So sabi ko, that means na yung katawan mo, young pa kasi marami kang side effect. Tawa siya ng tawa. Sabi ko, ba't ka tawa ng tawa? Sabi niya, paano ka, mami? Wala kang naramdaman. So, sabi ko, walang yaka and slam the phone down. So, yun lang po. Just sharing. Ikaw, Reina, Randy, and your dad, anong naramdaman nila?
They didn't, doktora, they didn't have any side effect. And
Old na
me,
rin sila.
if you can hear,
Nabiro
from
lang.
my,
Okay, sige.
yes. And me, if you can hear from my voice, I still have runny nose and a bit of cough na lang. It was a dry
Oh,
cough.
meron
No,
pa.
ano,
Oo.
no, there's no phlegm or whatever. Makati yung lalamunan, makati yung baga, if there's such a thing as makati ang baga. And then, ito, ngongo ako ngayon because of I think this is still the side effects. Because totoo yung sinabi ni doktora, magpahinga ka pagka after mo mabakunahan. Why? Very important yung pahinga kasi ako hindi ako nakapagpahinga. I have 2 babies to attend to. So, I have to really move around. So, eto, ganito po ang nangyari sa akin. This is my second week of having it. Of from the day I received the vaccine. Pang second week na po ngayon.
Ito naman ito lang, people who blame the vaccine, baka naman you just have allergic rhinitis. Baka naman
Yes,
you're just tired. Pwede rin, di ba?
Well,
Oo.
sabi naman po ng nurse at saka ng mga doctors na nandoon,
It's possible din.
yes. Actually, pag sumabay yung rhinitis ko, medyo mag-alala ko ng konti kasi we all know that if you are vaccinated, it will take some time for your body to get used to the vaccine, no? So during that time na kinikilala ng katawan mo yung vaccine na tinurok sa ihina ng konti ang resistensya. So kung sabayan ka pa ng
Possible.
rhinitis, yes, mas mataas
Pwede
ang
naman. Pwede naman.
yes, opo, mas mataas ang tama ng rhinitis sa akin ngayon. 'Yon.
Yeah.
Okay, next
So I'd
question.
like to mention, thanks Reina for sharing that. Okay pala si Randy at si Daddy. There are
Yes po.
unrelated health problems following vaccination. Meron po talaga Like for example, pwede ho kayong, you can get a cold. Pwede ho kayong sumakit ang tiyan, not related to the vaccination, nangyari lang po after the vaccine. So, huwag po kayong mag-alala doon. Meron din naman hong health problems with unknown cause. Halimbawa po, inatake kayo. May sakit na pala po kayo sa puso. And meron naman ho talagang inaatake sa araw-araw. So, that's why, meron din hong nasi-stroke sa araw-araw. So, that's why we have po the National Adverse Events Following Immunization Committee headed by Dr. Lulu Bravo para po ma-monitor ho talaga kung talagang may nangyari ho ba sa inyo or whether it's just really meron din ho. Strokes happen every day. Heart attack happen every day. So, may nangyayari pong gano'n.
I have to agree with that, Doktora.
Meron
Okay,
talaga
another, yes. Dear Doktora, what should we do after vaccinated to feel better?
Ayan. Ito po, once, first of all, as I mentioned, parang yung schedule nyo po, pag babakunahan na kayo, kung pwede, i-clear nyo lang ho ng konti. Okay? Number 2, tell your boss po na kayo po ay babakunahan. Para hindi naman, yung kung sakaling hindi ho kayo papasok the next day, at least naintindihan po nila kung bakit. Number 3, when you get home, you can put something cool on your arm kung sakali. Like medyo yung malamig na dim po, ganun po, to relax your arm. You can also stay in a cold room, yung electric fan, yung tapat nyo sa inyo. Just relax yourself. Don't do anything too stressful po on that day. Kung sakali pong kayo po ay lagnatin, it is okay to take paracetamol. Some people po take ibuprofen. So that's okay lang po. There's a question, no? Should you take paracetamol just in case may side effect? My advice po is, at nakalagay po talaga sa mga nababasa ko rin at ni-research, don't use the paracetamol unless you need it. Okay? Pero pwede naman din if you need it, then use it. So yun po, just relax. Kung sakali pong you're really not feeling good, call your doctor, or kung talagang nahihilo kayo, you're having hives, nahirapan po kayong huminga. Ano bang hives? Yung nagmamantal yung katawan nyo, that is an allergy, considered an allergy. Please go to the ER. Kung yung mata nyo po it's starting to swell, nahirapan huminga, again, please go to the ER. That is an allergy.
From Miss Morales Lacuna Dana, Doktora Ana, ano po pwede gawin pag may side effects na ang second dose ng Pfizer or Moderna?
Ma'am, again, ang advice po nila is really, first of all, to plan. Number 2, to relax in your house. You may take a paracetamol, you may rest. And if you're not really feeling well or namamantal or having difficulty po breathing, they would suggest you go to the ER.
From Mr. Jimmy Soryaga, good afternoon, Doktora Ana. Tanong ko lang po. 2 weeks na po ako natapos ng second dose ko ng Sinovac. Pwede na po ba ako magpa-flu vaccine? Thank you, Doktora.
Yes, pwede na po. Yes, you can. Ako po, kwento ko na lang. I had my flu vaccine last week. That's May, second week of May, third week of May. I had po my second dose of Sinovac second week of April. So, 1 month. So, pwede na po in 2 weeks.
From Miss Mel DPS. This is Mel DPS. My question is not related to the topic now, Doktora. May virtual checkup po ba kayo as pulmonology specialist? Can we set an appointment to you? Thank you.
Ma'am, we only do free consult on FB Live. If you need a pulmonary consult, marami po mga teleconference telecommunication companies po who do that.
Okay,
Gusto
from Miss
ko tulungan yung marami, hindi lang po yung isa. Ayan.
From Miss Viva Nazareno, AstraZeneca po ang asawa ko with comorbidities. Nagka-running nose on the first dose, parehas kami, Doc. But now, okay na po. July 12 po yung second dose. Kaya po nagva-vitamin C with zinc po kami. Hoping ma-vaccinated na rin po ako.
That is good. Good to hear that po. Okay.
From Mr. Jack Santos Tupas, Doktora, my husband and I both received Astra first dose. Both po kami naka-experience ng acid reflux for 2 to 3 days. Yung parang laging gutom po. Pero wala sa list ng side effects.
That's good. Okay lang po yun. I'm glad na parang 3 days sabi niya, no? So I guess it's okay. That's good. Lumipas na rin po.
Okay, good. From Miss Esterlita Candelaria Daito. Good afternoon, Dr. Ana. I received my second dose Sinovac last Friday. I am 62 years old. Kailan po ako pwede nang lumabas ng bahay? Nag-self-lockdown po kasi ako nung dumami COVID cases sa aming barangay. Thanks.
Ma'am, actually, no, in the US, those who are vaccinated twice, actually may recommendation pa po na huwag nang mag-mask. Dito po sa Pilipinas, we cannot give that recommendation yet. Na huwag nang mag-mask. Kasi po, 3.57% pa lang ho ang nababakunahan first dose po sa Metro Manila. So, we are not yet there. Whether you can leave your house, you can leave your house naman po. But again, use a mask and a face shield. So, ito po yung magiging na malaking issue talaga as we move forward, Those who are not vaccinated, especially mga seniors, malamang the government po will still require or request them to stay in their homes. And as more and more seniors are vaccinated, I think they may be allowed to leave. So, malaking issue po yan talaga.
Okay, I think that's all that we add. There's
Okay.
another one more. From Miss Sue Novesteras. Hi, Doktora. Kailan po pwede magpa-vaccine ng post-op? Tabso.
Ay, ma'am, you can be vaccinated po. Kailan ho ba kayo na-opera? I mean, kung kahapon lang ho, get out of the hospital muna. If it's like a month, you can already be vaccinated, ma'am. I hope it went well.
From Miss Tina de Guzman. Hi, Miss Tina. Thanks for constantly sharing, Doktora.
Hi, Miss Tina. Kababayan ko yan. And a very beautiful and active lady. With a cute kid named Anna. Cute ang mga Ana. Sorry ako lang ho nagbanggit nun. Okay.
From Miss Suno Vesteras noong April 29 po.
Okay, ma'am. I'm glad that you're okay. 2 weeks na rin po, no? Ano, it's actually almost a month. Pwede na po, ma'am. But again, no, wala naman pong masama na banggitin niyo po dun sa doktor nyo that you are planning to get yourself vaccinated. So, eto po, last words on side effects. Meron po talagang side effects, okay, after the vaccine. Hindi po natin alam kung sino magkakaroon ng side effects at kung sino naman po ang walang mararamdaman. However, most of the side effects po are mild. Wala pa po talagang na-proven na namatay dito po sa Pilipinas from a COVID vaccine, though a lot of people have already died from COVID, almost 20,000. So if you're worried po about side effects, what should you do? Number one, educate yourself. And ano po, don't just read Facebook or chismis, okay? Importante po na yung DOH, WHO, sa atin po, you can also listen. Don't hesitate to ask questions po para maliwanagan. And kung natatakot po talaga kayo sa side effects, mas nakakatakot pa kung magkaroon ng COVID. Okay? So sa inyo po lahat, thank you so much for joining us. Tomorrow po, we will be talking naman po in the morning. We'll try to do this in the morning. Ang topic po natin, lumihis lang po tayo ng konti sa COVID kasi talagang puro COVID na tayo since the surge. We're gonna talk po about manas. Bakit po namamanas sa mga tao and what to do about it. Manas po is called edema. Okay? So sa inyo po lahat, a very good evening. Thanks so much.